David, we spent a fair amount of time talking, and I've done my physical exam, and I want to kind of wrap things up. Mm-hmm. I'm very concerned about this pain you're having in your stomach. Maybe an ulcer, may just be some irritation, but I'm also concerned about the degree of stress you're under and how high your blood pressure's been. I do think you need a medication for your stomach, so I'm going to prescribe that for you. But I'd also like to talk a little bit more about your drinking, because that can and probably is affecting your stomach. You had mentioned earlier that you had cut down.
Yeah.
And in the last year?
Well, I don't drink as much as I did when I was younger.
Oh, I see.
Well, about 5 years ago, I was in the emergency room.
Well, that's right. You fractured one of the bones in your leg.
In my
yeah.
leg there.
What happened?
Well, it was during the holiday season time. Yeah, I probably had a few. But when I was decorating, I fell off the ladder, and the emergency room doctor told me that I should go to AA. But I told him that, you know, I resented the fact that he didn't think that I was an alcoholic, because I can control myself.
Mm-hmm. You also said your wife was nagging you about it. What's she worried about?
She just doesn't understand how stressful my job is. She says I get loud when I drink, you know.
So you're feeling stressed from stuff at the office and trying to bring it home and relax, and she doesn't understand. Must be frustrating.
It is frustrating. I just have a few to relax, that's all.
Mm-hmm. And when you say a few, just remind me again how many.
Well, I drink maybe 2, 3 drinks with clients, you know, at lunch, you know. But because I'm working, you know, the hours that I work, maybe for me to relax, I would probably have 6, 7 drinks, you know, in the night.
We've got a dilemma here, because what I hear is the alcohol's helping you. You feel it relieves your stress and really makes things bearable. On the other hand, it's raising your blood pressure. Anyone who drinks more than 4 drinks a day puts your blood pressure up. It's clearly affecting your stomach. Your wife's upset. You're telling me that you're drinking an amount of alcohol that is way above the recommended limits. From a medical standpoint, I think it would be better for you to stop completely, but I want to do something that's going to be possible for you. I would recommend, if you're going to cut down, that you cut down to 2 drinks a day, so that's 14 a week, and no more than 4 on any one occasion. What do you think about that?
I can probably do that.
Okay. So you think you're ready to make a change?
I can make a change because I don't want to be like my mom was. I want to stay in shape.
You know, I think that's an important thing to keep in mind. I would like to say one thing. Sometimes when people cut down, they find that they have trouble sleeping, or they may not feel well, or feel really shaky. If that happens to you, just give me a call, because we should talk about that. Okay?
I can work with that.
Let's see how you do. I mean, our goal is your health. If you can't make it down to the 14 a week, let's see what you've been able to do, and see how your stomach's doing. I mean, okay, so our goal is to get you feeling better, and also to find ways for you to feel less stressed. And I think if I don't get you back to your office, you're going to feel more stressed.
Yeah,
Let me give you the prescription, okay?
Yes.